question number 153. The answer of this question is A, that is T cells. Well, as we know that rheumatoid arthritis is a chronic inflammatory disease having autoimmune etiology. And the primary site of the disease is synovial membrane. So ultimately in a joint, where synovium is the first to involve, later on it involves the cartilage and later on it involves the bones also. And ultimately it leads to bone deformity. Okay, that means it is a type of erosive arthritis. Erosive arthritis means it leads to joint deformity. Now let us see what are the example of non-erosive arthritis. Is a very frequently asked question. The non-erosive arthritis, the important causes are arthritis occurring in rheumatic fever, in SLE, in Behçet syndrome, and in Whipple disease. These are the four important causes where we get non-erosive, that is non-deforming arthritis. That means patient has joint pains, but once the pain disappears, joints are totally normal, there is no deformity, right? But remember, now important causes of erosive arthritis, other than the rheumatoid arthritis, osteoarthrosis, gout, and pseudo-gout. They are the example of erosive arthritis, right? Now, one more extra point about RA. In RA, TNF-alpha plays a very important role in the pathogenesis of rheumatoid arthritis. That's why TNF-alpha neutralizing drug like infliximab, etanercept, adalimumab, golimumab, they are very effective in this case of treatment of rheumatoid arthritis. Now let's learn about certain other group of drugs that we use in rheumatoid arthritis. Of course, newer drugs I'm talking about. We also use rituximab. It is an anti-CD20 drug. We also use abatacept. It is a fusion protein. We also use anakinra. It's an interleukin-1 antagonist. We also use tocilizumab, which is an interleukin-6 antagonist. Okay? So I hope you are clear about the newer drugs what we use in rheumatoid arthritis.